Health, to say, is wealth, and the greatest wealth is health. My name is Emedion James, and welcome to Wellbeing, a program that informs, educates, and keeps you updated on your general well-being. On today's show on Wellbeing, we'll be talking about asthma. Do you know what is asthma? Have you ever been around someone who has asthma and you don't know what to do about it? When last did you even go for a respiratory checkup? Before I delve deep into the topic, I'd like you to just watch this video with me. When we return, we're going to go deep into how asthma was discovered, the symptoms, and how it can be managed.
Hippocrates, a figure people often label as the grandfather of modern medicine, was the first person on record to link asthma symptoms to environmental triggers and specific traits and professions such as metal work. Hippocrates only saw asthma as a symptom, and it was not until around 100 ACE that a Greek physician called Herodotus of Cappadocia mentioned of asthma that was similar to the modern understanding of how the disease develops. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to recurrent episodes of wheezing, shortness of breath, chest tightness, and coughing. It affects people of all ages and can vary in severity from mild to life-threatening. According to WHO, asthma affected an estimated 262 million people in 2019 and caused 455,000 deaths. Asthma is a major non-communicable disease affecting both children and adults and is most common chronic disease among children. About 1,000 people per day die from asthma. These fatalities are of serious concern because many of them are preventable. In Nigeria, the cost of asthma medicines is not subsidized. One multi-center study found a high prevalence of wheeze in over 20,000 children and adults. With a predicted population of over 13 million people with asthma in Nigeria, adults over 45 years carry the highest burden of the prevalence of wheeze in the past 12 months at 15%. Underdiagnosis of asthma remains a challenge, with only 4% of people with asthma having been diagnosed by a physician. The exact cause of asthma is not fully understood, but it is believed to involve a combination of genetic and environmental factors. Common triggers include allergens such as pollen, dust mites, pet dander, mold, and certain foods, respiratory infection, tobacco smoke, air pollution, cold air, exercise, and emotional stress. These triggers can lead to the inflammation of the airways, increased mucus production, and constriction of the muscles around the airways, making it difficult to breathe. However, there have been new developments in asthma treatment guidelines with the introduction of the use of low-dose inhaled corticosteroids to be taken whenever short-acting B2 agonist is used at step 1 mild asthma. On today's show on Wellbeing, we are going to extensively talk about the causes of asthma, symptoms of asthma, how it can be managed, how inhalers can be used effectively. In the course of our discussion, we'll be using words like wheezing, inflammation, and bronchitis. Wheezing is a shrilled whistle or coarse rattle you hear when your airway is partially blocked. It might be blocked because of an allergic reaction, a cold, bronchitis, or allergies. Wheezing is also a symptom of asthma, pneumonia, heart failure, and more. It could go away on its own, or it could be a sign of a serious condition. Inflammation is when the heart reduces the ability to pump blood. Inflammation in the heart can lead to other serious heart problems such as irregular heartbeat, heart failure, or coronary heart disease. Many things can cause heart inflammation. Inflammation is when the heart reduces its ability to pump blood. Inflammation in the heart can lead to other serious health problems, including an irregular heartbeat or heart failure. Bronchi is the large air passages that lead from the trachea, that is the windpipe, to the lungs. Join us now on Wellbeing as we talk with different doctors about asthma.
Good health, they say, is something you can't buy. But the decision to live healthy is a choice that you'd have to make. Join health practitioners from diverse health fields as they provide you with vital information to help your day-to-day health decisions on Wellbeing, your wellness talk show. Wellbeing airs every Monday, 7 to 7:30 p.m. only on Spectrum TV.
Many thanks for staying tuned. What really got to me was that they said every day 1,000 people die of asthma, which makes me curious. What really is asthma? Let's listen to what pharmacist Oriel had to say about this.
Asthma, I want to define it as a chronic, long-term lung diseases that inflames the airways, bronchioles in particular, which results in a whistling sound, like whistle, then breathlessness, chest pain, and it often occurs in the night, and it affects majorly children from 2 years and above and all that. So that's how I can define asthma. Asthma affects the body by causing the bronchioles to inflame. The major cause of asthma, why it is asthma, is because the bronchioles, the airways is inflamed. That is why the airways cannot pass, the air cannot pass through the lungs for metabolic function. So that inflammation is what majorly causes asthma, that inflammation of the airways.
So one thing he said that really got to me was why it's called asthma. Most times we just use the word and never really know why it's called that name. He said it's called asthma because the bronchioles and the airwaves is inflamed. I don't know if you listened to the video earlier. We actually explained what inflammation means, bronchioles means, or bronchitis means, and also wheezing. So in the course of our discussion, you most likely hear us use words like wheezing, inflammation, and bronchitis. Now, I don't want you to be confused when you hear these words. Anyways, let's talk about the types of asthma. How many types of asthma do you think we have? And also, let's talk about the triggers of asthma, the causes, and finally, if you see someone with asthma, or possibly if you see these basic signs, you can say to yourself, oh, I think I'm asthmatic, or that person is asthmatic. Let's listen to this pharmacist Oriel. She'll tell us more on the causes, triggers, and symptoms of asthma.
Asthma has different types. Number one type is allergic asthma. There are a lot of allergies, like triggers in the environment can cause allergy, dust, smoke. And some people that work in factories, they can have allergy, and that can cause allergic asthma. Another one is occupational asthma. There are people who are working like in paint industry, and some in environments that there are allergies triggers. People like that can come down with asthma. Another one is hereditary, non-allergic asthma, hereditary. Many people who have asthma actually inherited it from their parents, from their parental generation. Maybe the father, the mother, the family members must have had asthma, and also they inherited it from their parents. Another one is type of asthma is exercise-induced asthma. Some people who happen to carry out exercises, particularly in the morning when there's cold, they are bound to come down with asthma. Seasonal, like this cold season, some people can come down with asthma, even if they themselves were not initially asthmatic. Some people come down with asthma. So those are some of the types of asthma.
Things we call asthma triggers, those are things that could possibly irritate the respiratory tract, lead to inflammation of the airways, constriction of the hyper-responsiveness and constriction of the airways.
What a wonderful explanation. Asthma was clearly distinguished from other respiratory disorders in 1698 by English physician called Sir John Floyer. Now the quick question is there any cure for asthma? I don't know about you, but I'm very curious to know. Is there any cure for asthma? Because over the years, I've heard people actually talk about, being healed of asthma, taking herbs to get rid of asthma and all. So let's hear from a pharmacist what he has to say about the cure for asthma.
Yes, asthma is not curable. He mentioned something about, the first speaker talked about it being a chronic lifelong disease. Yes, it's not curable, but you can manage the condition. So if you can manage those conditions, you can also reduce those exacerbations which lead to the inflammations. That's why we say avoid the triggers, breathe well and live well. But again, also we have controller medications, inhaled corticosteroids. Those come as inhalers. You take them, sometimes you have them in combination, inhaled corticosteroids and all those long duration bronchodilators and all that. So depending on the diagnosis and the assessment by the respiratory physician, he will place you on the right type of drugs.
Thank you so much for that explanation. I'm particularly concerned. Are there foods that an asthmatic person can eat in order to be healthy? And also, are there foods that they can avoid? Because over the years, I've actually been privileged to stay around asthmatic people, and then I get to hear them say, oh, I don't eat this, I don't take that, I'm not supposed to take that. So I'm just wondering, are there foods that, okay, fine, if I'm asthmatic, since there is no cure, I am meant to be eating this particular food, or this particular food, look, I cannot eat it because I'm asthmatic?
Any food that essentially improves your immunity is good for an asthmatic patient. I remember growing up, I had a grandma who, when she took rice, heavily starchy food, she would have symptoms. Some don't have. You understand? Then, like I told you, I've mentioned a friend too that reacted to heavily, this when the foods are so oily, she'll just start coughing, one funny cough. I can't really explain it. She knew that the oils were not good for her, but once in a while she'll crave for them. And she'll tell me, let's pass by this way. You love to eat that roasted. She said, I know this thing will disturb me, but I want to eat it. And funny enough, after she finishes eating it with a funny cough, so I think we can identify it. You see also instances that maybe if you have rock carpets and stuff, furniture, and you keep them in your house, your child starts having a cough that doesn't respond to medication. You use all these antibiotics, and that would be an indication that you should screen and find out whether your child is allergic to, So it's possible to identify those irritants. That's what we are saying. It's possible to know them, those triggers, and avoid them.
Thank you so much, Dr. Ruth, for that detailed explanation. Now let's talk about inhalers. How can inhalers be used effectively? And when should I use an inhaler? Because over time, I've seen people they have a small chest pain and they just pop inhalers. So tell me, how many types of inhalers do we have, and how can one use inhalers effectively?
Sometimes you pick these inhalers on the shelf. It's been there for a while, so you don't really know. Maybe that's a propellant may have settled. So the first thing we do is to shake it about 10 to 15 times. Then release the first 2 puffs. After releasing the first 2 puffs, you should practice breathing out. Breathe out for a while. When it looks like you don't have any other air to breathe out, that's when you take in. You take it in and wait. There's this formula that is advocated, 4-4-4. You take 4 puffs, breathe out, and then you take, you like wait. But actually, what happens is that in some instances, they will tell you, if you check those canisters, don't take more than an amount of puffs at a specific time. So we should always read those instructions. Some people take just 2 puffs a day and they're okay. Some don't even need to puff for a while. That's for those that use reliever medications. Those are those ones if you have an attack you take. But we have medications you use to like prevent. Those ones that advise that you use it every day. So you may be advised to take a puff or 2 a day, as the case may be.
Thank you so much, ma'am, for that explanation. I don't know about you, but then I just learned something. There was something that she said that it really got to me. He talked about 4-4-4. That's 4 pulse breath. You wait, and then you breathe in 4 times. You take in the inhaler 4 times, and then you now exhale out 4 times. Now, according to what she said, it varies between people. Now, let's say, for instance, I'm asthmatic. If I go to a doctor will tell me, okay, fine, for this inhaler, this is how many puffs that you are meant to take. And that's to say to you out there, don't just take inhalers or don't just walk into a pharmacy and get an inhaler. Instead, reach out to a respiratory doctor who would give you detailed advice on how you can use inhalers effectively. I might use 4 puffs. You might, in your own situation, you might need just 2. In another person's situation, you might need just 3. So try as much as possible to seek the advice of a doctor. Don't just take a puff just because you saw someone else do it. Thank you so much, Dr. Ruth. Now over to the next question. Let's talk about smoking and alcohol. Now, let's say, for instance, that someone is already addicted to smoking and the person happens to be asthmatic. How bad is smoking or alcohol to the health?
We know that smoke could be an irritant. For some people, smoke is a trigger. Then again, you know that everybody that stays around someone who smokes is actually is passive smoker. So even though you are not asthmatic, you're taking it in over time. So of course, it will be hazardous to the respiratory system. So smoking is not advocated, whether you are not even asthmatic. So for an asthmatic patient, I would say do not smoke. Then alcohol too. Complications of alcohol over time, cirrhosis and all that. But I think alcohol also lowers immunity. So you should not take alcohol if you're an asthmatic patient.
I usually tell people smoking is a no-no. You don't even have to be asthmatic to avoid smoking. It's not even good for your lungs. Alcohol is not even good for your liver. So for your own health's sake, just I tell people, become a water addict, become a fruit addict, but not smoke, not alcohol. It's dangerous to you. I know most times it gives you the pleasure, but then let's look at the long run. Then let's talk more of you now being asthmatic. For you to live long, remember there is no cure for asthma, but it can be managed. And one way to manage it is to avoid alcohol and smoking. Now, my next question is, if I happen to stay close to someone that has asthma, what should I do? Because I know in movies, we've seen a situation where somebody had an asthma attack and then they brought spoon and pushed it into the person's mouth, or they poured the person water, or they did so many things. So do you mind telling us, Dr. Ruth, if I see someone who is asthmatic, what should I do?
Yeah, the first thing you should do is try to help the person use his or her inhaler. I think if the person is not with an inhaler, the first thing you should do is call 911 or get the person to a hospital. That will be one of the things. Essentially, that inhaler is life-saving because that drug delivers to your respiratory system and it relieves that inflammation so the person can now breathe. It's a bronchodilator that is inside. For instance, if you have a product like salbutamol inhaler, although you have some which are corticosteroids, salbutamol release bronchoconstriction. But if you have something like a corticosteroid, it releases inflammation. And the pathophysiology of asthma, you have that inflammation, hyperresponsiveness, then the bronchoconstriction. So sometimes you have a combination of medication to take care of each of those, ailments or those things that cause that acute attack.
Wow. Thank you so much for that detailed explanation. And also, the video there was quite helpful. If you happen to be around somebody that is asthmatic, the first thing to do is get their inhaler. Now, I know I asked, if the person is not with their inhalers, what should they do? I think the person has to sit up right first. You get the person to loosen up and then sit up right before maybe you could call for help, or you could just make the person feel free and make sure that there is sufficient ventilation. But every asthmatic person must always be with their inhaler. So one way you can help an asthmatic person around you is to remind them to always be with their inhaler. I'll tell you a very funny story. I had a friend who was asthmatic, and then every day we always remind her, "Princess, are you with your inhaler? Where is your inhaler? Did you go with your inhaler?" In fact, we made it in such a way that our inhaler was more like a wristband. So we bought a wristband for her and we put the inhaler there. Why? Because her life was very valuable to us. So if you have any friend or you know someone around you who is asthmatic, please encourage them to always be with their inhalers. And also, if you're asthmatic, please, your inhaler is like the best. It's like your ATM card. Never go outside without it, because you never can tell when the attack will happen. Hopefully by 2030, I'm just saying, the cure will be found. But for now, please, let's keep our inhalers close to us. Now, to our next question. Most people say asthma is caused by witchcraft. So most times you get someone say, she was just sitting down, and then she started to do, and before you know it, she died. Or, in Nigeria, we say all those things a lot. So, Dr. Ruth, do you think that, I want you to, I don't want to really say yes or no, but I want you to help us. Do you think that asthma is witchcraft related? Because over time, I've heard people say asthma is not just asthma. I've heard people talk about TB, they put their heart in a witchcraft circle and they were pounding it, and for every time they pound it, they will cough in the physical. So help me give more clarity on this superstitious belief.
Every sickness is caused by something. What you need to do is to screen, test, identify it, and treat. Just like how you treat malaria. But in the case of asthma, because it's chronic, you can only manage. It's not that you treat today and you never have it again. It may erupt, it may reoccur. Maybe sometime, but it's possible that you could also manage your symptoms and you're able to live life optimally. That is our desire. That's why we did this awareness and education, so that people could be aware. Look, these are the triggers. You didn't just you were not just born. You had asthma. He identified his own. Some of us were able to identify, if I drink very cold, extreme cold, affects me, or if I stay in a harsh environment, it's so hot, it's so stuffy. So once an environment is stuffy, you can step out and take air, and you wouldn't have an attack. So identify your triggers, and then you will be able to manage, those symptoms and live life optimally. Breathe well, live well. If you're having respiratory symptoms and you don't know what it is, you should see a respiratory physician for screening and diagnosis. Then, of course, as he screens you, you will be given an appropriate prescription to manage your symptoms. But in maybe, let's say you like actually started taking your medications and you notice you were doing well, and all of a sudden you start having attacks more often, you should know that something is up. You should visit your physician.
Thank you so much, Dr. Ruth. Now, the most important thing is that if you notice these symptoms in you, go to a respiratory doctor. I think we live in the 21st century where we now have doctors nearby. Most times people are scared of getting screened because they think, they're going to charge me. But guess what? If you don't go for proper screening, you know how they say that prevention is better than cure. Trust me, the cure will be more expensive. And in asthma, there is no cure. It can only be managed. So I would like to advise everybody, If you are around someone who has, displayed all the symptoms of asthma, please take the person to a hospital. Asthma is not a spiritual problem. It is caused by environment, or it could be, genetic. Quit the saying that it's breathing like this because they're squeezing your neck. Trust me, most times the witches are even surprised at us accusing them. So this is it from Dr. Ruth. When you notice this sign, go to a doctor for help. Now, somebody asks, if I'm asthmatic, is there hope for me to still make it in life? I'd like you to watch a video of a pharmacist who happened to be an asthmatic patient and was able to discover, manage, and still make it in life.
My own experience, I think this started when I was in my JS1. I've never known I was asthmatic. I was in a boarding school. So it was when I think after my first term in my JS1, I now went back for holiday, and I wanted to go back for the second term. And at that time, I think my dad was also a teacher. He was transferred from a school that he was to another school. So I don't know whether it was because that environment that we went to was extremely cool, and there used to be a lot of hair. So I don't know whether that is what really bring out the asthma that was lying in me. But from history, I got to know that my grandmom used to have that trait, used to be asthmatic. So as you can see, it's a kind of hereditary kind of disease. So I grew up, in fact, it was very challenging to me because I've never experienced it. As a child, you could imagine the experience at that time. A lot of heart congestion, a lot of chest, like you mentioned, chest pain. I used to crumble. Like my own, when it comes, if I don't sit on a chair with a pillow, I will not be able to sleep throughout the night. So it was always, I used to have this difficulty in breathing, a lot of wheezing sound that will make, the next person lying close to you very uncomfortable. Just that I had a very caring parent at that time that, that used to care for me. I survived it. I used to play football then as a child, but I couldn't go out. I would be sitting on a chair looking at my friends and my classmates playing football. I can't jump. And most of the time, mine used to be very worse when it gets to Harmattan season. I will always be indoors. So there was a lot of restriction. I couldn't play football again as a young boy. I happened to read pharmacy. So that knowledge of drugs, of how to take care of myself, begin to rank on my hair. And so I could know, as an adult, I could know what to avoid and all the do and the don'ts of asthma. And that is what has helped me to stay healthy and stay alive. I do regular exercise, I do jogging, but not heavy, not exercise that could strain you. At least mild exercise, at least I'll keep your body going.
Good health, they say, is something you can't buy. But the decision to live healthy is a choice that you have to make. Join health practitioners from diverse health fields as they provide you with vital information to help your day-to-day health decisions on Well-Being, your wellness talk show. Well-Being airs every Monday, 7 to 7:30 p.m. only on Spectrum TV.
Asthma is not the end of the world. You can still get to the peak of your life if you manage it properly. Yes, most times when you have asthma, there are things that you would not be able to do. But then there are other things that you can do. Most times in life, we focus on the things that we cannot do more than the things that we do. Yes, you are asthmatic, you will not be able to go to the gym and jump, but then you can think, you can read. Pharmacist Toro, do you know what it means to be a pharmacist? Like literally 5 years reading and studying to get to that level. And that's to say to you out there, if you're asthmatic, don't give up. There is still hope for you. It can be managed. It can be managed in such a way that you can become great. You have to learn how to avoid strenuous exercise. Now, don't tell me I was born to be a runner. I was born to be an athlete. Well, we are all born to be, different things. Just condition your mind to make it. Please, in case you're asthmatic and you're depressed, or in case you're asthmatic and you feel you can never be great, I'm here to tell you, and also you've seen Dr. Itoro boldly tell you that it's possible to be asthmatic and also it's possible to be asthmatic and also relevant in your society. Before we go, let's hear what people have to say about asthma.
Asthma, as much as I know, is more like a disease or a health condition that is caused by a particular situation, which is most times you see the person trying to gasp for air, trying to breathe and all of that. So I think it's a respiratory kind of disease or infection. So when you have such a situation, you have to seek medical advice, get to see a doctor, get the proper, don't stand by the roadside and get a drug and they will say, oh, this person used to treat it, my mother used to treat it, or this other native person used to treat it. Get to the hospital, get the proper diagnosis and then proper treatment, because I always believe in early diagnosis. When you diagnose a disease early, you are able to know how to manage or treat. So I think the best advice is get to the hospital, get diagnosed, and then get treated.
It's a disease that shouldn't be taken off guard because it kills. I know of so many people, especially my brother, as an example, had asthma, but to God be the glory, he's fine now. But I think people should really take precautions, and once they see the symptoms, they should rush to the hospital for checkup to check so that it will be tackled in time.
Asthma is a chronic disease that usually affects the lungs, and it usually presents in all age groups, from children to grown-ups, and it's usually presents mainly as difficulty in breathing when exposed to the allergens that causes asthma. Asthma can either be intrinsic or extrinsic, meaning that extrinsic means it's when you are exposed to stuff like dust or perfumes, or that's when it causes the asthma. Then intrinsic is you have an immune response to asthma. Then asthma usually presents as cough, chest tightness, difficulty in breathing, and all that. It can be prevented by preventing the allergens that causes asthma, and it can also be prevented by consistent and correct use of your medications.
And with that, we've come to the end of today's show on well-being. This week, we're actually talking about cardiovascular health, and today we paid attention to a disease called asthma. I trust you are well educated and informed. Now, just so you know, every 7th May, it is recognized by the UN as World Asthma Day. And the theme for this year was Asthma Education Empowers. It is important to educate individuals with asthma to manage their condition better and recognize when medical intervention is necessary. This is Wellbeing on Spectrum TV. Next week, we'll be talking about another cardiovascular health issues. Now, if you have any particular topic you want us to talk about, or you have a question or a contribution, just go to our social media handles at Spectrum TV, or you can go to our website at spectrumtvlive.ng and drop your comments, and we'll reach out to you as soon as possible. I am Imogen James. Remember, your health is wealth. See you same time, same station. Bye for now.